May I do this?
It's already hurting. Oh.
Got it. Got it. So you had a little bit of a pinch there. Do you feel those crack?
It's so ticklish.
Do you feel them crack? It went, boom. All right, so we have Abigail here today. Thank you for joining us and being here. And we're gonna do some full body adjustment and also this cranial facial release. What did you hear about it, or did you just spot it on Instagram, or like why are you here?
Well, I'm here for a full body adjustment and the CRF, I saw it and I was like, I need to try this. This is right up my alley. I'm totally into alternative care.
You told me you had a bad spot on the left lower back and the right shoulder blade.
Yes.
So we're gonna definitely focus on that. And then is there any reason you wanted to do the CFR? Like, do you have any breathing difficulties or any disturbances when you sleep or anything that you're aware of?
Not that I'm aware of, but it does help to walk through this like breathing properly.
Yes.
So why not open?
That's true. And we're supposed to get real efficient breathing nasally. There's a lot of people over time that are having experienced some either over breathing because they're like, through their mouth, and efficiency. We want to be able to close our mouth and be able to get air in. Plus the air through the nose gets back into that diaphragm breathing that's even more healthy than to do the superficial chest breath. So it never hurts for someone to have a wellness with a cranial facial release. So let's get cracking. You can feel some of the tightness, this shoulder blade. Is that painful to the touch, or is it okay?
Not right now. It's good over right there, yeah.
So what I'm feeling is the ribs articulate with the side of the vertebra at the costovertebral joint. Costo means rib, vertebral is the vertebra. And you have a couple of ribs here that are a little elevated and a little bit tense, like the muscles surrounding them are a little bit in spasm. And I don't feel it as much on this side. The ribs, because you have low body fat, we can feel the ribs easily on you, but these don't feel misaligned like they do on this side. Do these feel a little more tender on this side if I palpate than this side?
Absolutely.
Okay. So what's nice is there's a really good adjustment for that, and I think I can get them to really release and bring them back to a more balanced position, and it allow the muscles and to relax and the blood flow again. I think you'll see an immediate shift. So we'll do that in just a minute, okay? I'm gonna do just a little deep tissue work on you. Big breath in and blow it out. So now I'm on the right SI joint, which is not the involved one, but I'm starting on the good side. Often I'll start on the good side because it shows me a little bit how more normal movement is feeling comparatively before I get to your side that has more symptoms.
Oh.
All right, so we're gonna do a few adjustments next, okay? Do you feel okay? And I'm gonna work on the base of your skull here, right where it meets the top, the neck meets the skull. And you're gonna turn this way, just a little and tilt over. May I do this?
It's already hurting. Oh.
Got it. So that's why I wanted to get that one, because it was jammed. It was compressed. And that's a good release. Does it feel okay?
Absolutely. Yeah.
So next I'm gonna have you lie on your back. May I put my hand inside here like this? I'm gonna grab your elbow, reach under, big breath in, and blow it out. It already went a little bit as I had you there. Big breath in. Here it goes. Whew. All right. I'm going to work on the hip and ankle a little bit. Is that okay?
Yes.
That's your hip.
Yes.
And here's the other side. So I set those hips. They were a little tight where the ball of the femur was up into the socket a little too tight. So I created space.
Beautiful.
The hands go here next. And maybe come back up higher on the table again. Yeah, that should be good. So I already did the left side, but I want to drop down and get the right side because you also have this spot here. Do you feel it? So big breath in and blow it out. Perfect. How was that? Good.
Amazing.
Big breath in. Perfect. Do you feel those crack?
It's so ticklish.
Do you feel them crack? Like, boom. So come stand and see how you feel, and then we're going to start you with the CFR next, the Cranial Facial Release.
So,
Do you feeling still on the right?
a little bit.
Okay, so we'll have to go back to that.
Just a little. Oops,
Okay.
just a little bit.
So let's see what we can do in that spot.
It's literally right here.
Okay. And part of that could be muscle, so let me get on that muscle. In there, you mean?
Oh my God.
Okay.
Oh my God. Oh.
Got it. So you had a little bit of a pinch there.
Yes, that was it. Thank you.
Good, you're welcome.
Oh my God.
Stand up again and see if it feels a little changed.
Completely.
Good. So now we're going to do the CFR. You've seen a few videos or little clips of this before, right? To get a sense of it?
I feel like I'm floating.
Good, right?
So thank you so much.
You're welcome.
Oh my gosh.
Good. I'm glad that it helped a little bit. So here's the right side. Whenever you're ready, take a breath in and close your lips.
Oh, whoa. Oh. Oof.
Point
But I'm
to,
able to inhale very clearly now.
like it got you more air, right?
Absolutely.
Point to the part of your face that you remember experiencing something.
It was in this area. Yeah. Actually, it's super tender right here is where, yeah.
Yeah, because there was a big stuck spot there, and that's what you heard crack and release.
What was stuck?
Well, we have 22 bones in the face and skull that have the ability to move, stretch, expand, and flex. And I felt like there was a little spot here that was very rigid, and as the balloon went and expanded, it and opened a little bit.
Yes.
Okay, so we're going to do the second side now. Most people feel the second one's a little easier because they know what to expect, but let's get started. That side's a little tighter, actually. Big breath in and close.
I can breathe, and I just cracked my ears.
Yeah, so most people have to blow their nose, and they'll continue to need to blow their nose throughout the day, which is good. because you want to get everything to clear out. How you doing now?
I'm able to breathe very nicely.
Good.
I'm so much more open.
Well, thank you for participating today and
Thank you for
giving this a
having
try.
me.
Appreciate
Seriously,
it.
thank you.
All right, thank you, everyone.
Oh,
Got it. So that's why I wanted to get that one, because it was jammed. It was compressed. And that's a good release.
it feels
Does it feel
good.
okay?
Absolutely.